Hello everyone, welcome to the section of cardiology. This is Dr. Jaitly. Here I'll be talking to you about aortic stenosis, AS as it's commonly known as, in this video section. Let's understand the basic features of aortic stenosis first through this brief talk. What are the causes of aortic stenosis? What are the clinical features and how does it manifest, and what the findings on an ECG or EKG would be, and what will be the findings on the echo Doppler here. So aortic stenosis is a failure to open the aortic valve completely, either because of stenosis from an inflammation, degenerative process, or a calcific process. So let's understand. Inflammatory process, which is commonest obviously, is rheumatic heart disease, very prevalent in developing countries, but there's a resurgence also now commonly seen in the inner cities of the developed countries as well. Congenital variety is common but normally manifests at a later stage or age and time, but it's usually because of the bicuspid aortic valve, because remember, aortic valve is trileaflet, just like any other leaflet except the mitral valve, which is bileaflet. So being a bicuspid or unicuspid sometimes, that malformation can lead to accelerated form of calcification, and as a result the stenosis occurs and therefore presents as aortic stenosis. Degenerative heart disease obviously is a calcific age-related process. It's very similar to other atherosclerosis elsewhere that occurs, especially in settings of hypertension, diabetes, smoking, and hyperlipidemia, which is high cholesterol and high triglyceride states. So some of those factors are common in this setting where degenerative heart disease will present as aortic stenosis in addition to multiple other risk factors, and therefore the treatment will also depend on how well you can reverse some of these or treat some of these. Then there's a calcific variety which also occurs in Paget's disease, for instance. We know Paget's patients carry a lot of calcium in their serum or plasma, and then end-stage renal disease also have calcium problems. So there is some evidence that increased calcium in serum, plasma, or blood will lead to somehow the aortic valve likes the calcium and goes there and causes the aortic stenosis. So just take that as a denominator. What are the clinical features? Obviously, it's a triad of features which are very commonly stated. One is angina or chest pain. Syncope is the other one, where there's a loss of consciousness. And then there is heart failure, where there's signs of left ventricular heart failure predominantly first, and then later on the right-sided failures also develop. So left-sided failure will be marked by shortness of breath and PND, where the person is not able to sleep well in the night and wakes up in the middle of the night around like 2 a.m., 3 a.m., 4 a.m., being extremely breathless, walks up to the window, tries to get some breath, fresh breaths, and then come back and sleep. So these are common left ventricular failure signs that will develop. And by the time this has developed, obviously the aortic stenosis has progressed far ahead. So angina could be related to the coronaries because they originate from the aortic valve right here, as I'm showing you on the left panel, because the coronaries or the ostia of the coronaries are situated in the aortic cusps. But then you can have also angina because of the coronary arterial obstruction. That's called CAD in addition. So it's a combination of causes. Now, physical findings will be remarkable in that there will be a diamond-shaped systolic, a very harsh quality murmur, sustained LV impulse, and sometimes the left ventricular heave can be felt. ECG will clearly show an LVH of magnitude, and of course that will be confirmed by an echo. Let's move to the right side of the panel, where the left ventricle tends to be very thick, and its concentric left ventricular hypertrophy is quite evident in the setting of aortic stenosis. Now this aortic valve, which is the outflow tract right here, the aortic valve is not opening up too well. So what happens is there's pressure gradient developing between this pre-valve and the post-valve area. So similarly here, you have all these small little arrows that I'm trying to show. There's more gradient here, and then drop in the pressure here, because now obviously once the stenosis is negotiated, then the blood flows. But obviously there's a pressure gradient of a severe nature between left ventricle and across the aortic valve into the outflow tract. There's also concentric left ventricular hypertrophy that can be confirmed by an echo. And then you have a dilated left atrium. The left atrium gets bigger. So the left atrium is here on the echo panel, and the left ventricle is showing signs of concentric LVH. So these are the common symptoms and signs and the clinical features and the echocardiographic and electrocardiographic features of aortic stenosis. Okay, and we'll discuss more as we move on with further intricacies with the rest of the valves, and same here also with aortic stenosis. Hope you enjoyed this discussion. Talk to you soon. Bye now.